Researchers at Stanford University are warning the U.S. could see more than 11 million measles cases in the next 25 years if vaccination levels drop just 10%. If vaccinations stay at their current rate, researchers still say cases could grow to more than 851,000 by the year 2050. The Centers for Disease Control and Prevention says the U.S. is dealing with 800 cases of the measles nationwide, a disease that had been declared eliminated in the country in the year 2000. Dr. Amesh Adalja joins us now. He's an infectious disease physician and senior scholar at the Johns Hopkins Center for Health Security. Doctor, good to see you. These are jaw-dropping numbers. How do we get from having a disease declared as eliminated in 2000 in the U.S. to now 800 cases across 24 states, with hundreds of thousands projected by 2050 if trends stay the same?
This is the most contagious virus that's known to humankind. So what that means is that it requires a very high level of immunization. And just slipping from 95% to 80% or 85%, 90%, that gives the virus a major ability to spread. And in the pre-vaccine era, there were millions of cases that occurred every year. So when you think of these numbers, they don't seem that big in terms of the percentage of vaccinated, but it means a lot when you're dealing with such a contagious virus. And that's why the stakes are so high with measles.
So 95% is what we need for herd immunity, doctor?
Yes, 95% of the population needs to be protected to make the virus kind of find itself in an inhospitable environment. And even, as I said before, even just 90% is enough for the virus to really spread rampantly.
Is messaging from health officials a factor in declining vaccine rates?
Definitely. You know, our leading health official in the United States is unfortunately RFK Jr., and he is an anti-vaccine propagandist and has been that for decades. And he has had very tepid endorsements of the vaccine, even and has kind of put all of these other alternative treatments ahead of it, such as cod liver oil, vitamin A. So yes, we're not getting a really good strong, aggressive message about the essential nature of the vaccine in extinguishing these outbreaks that are going on in West Texas and New Mexico, Oklahoma. There's now one in Erie, Pennsylvania. They're occurring all over. But the solution is something that's not novel. We've had this solution since the 1960s. It's to get the vaccination rate up.
So measles cases have been confirmed in 24 states. We're showing a map right now. Should this be a concern for people who are already vaccinated? I mean, does the vaccine lose effectiveness over time?
No, this vaccine is one of our best vaccines. So if you are fully vaccinated against measles, you are going to be protected. These are outbreaks that are occurring in unvaccinated individuals, either people who have chosen not to be vaccinated or their parents chose to not vaccinate them, or they're too young to be vaccinated. This is not happening in vaccinated individuals. There's a very, very small number of people that are vaccinated that get measles. This is one of our most potent vaccines, which is why we were able to eliminate measles, because this vaccine is so efficacious.
So, okay, I just need to ask something, though. Are there vulnerable people? For example, I don't think you can get an MMR shot until what age, doctor?
Well, we start to give those the first MMR shot around 12 to 15 months, and then the second shot is around 5 to 7 years. So so there are children that are less than a year old that are not eligible to get vaccinated against MMR. And we are now trying to vaccinate children as low as 6 months. It doesn't work as well in those individuals, but we're starting to move those vaccinations up to try and protect that group, because that's the group that's always going to be vulnerable, because the vaccine doesn't take well in children with that immature of an immune system, and because they still have antibodies from their mother that are circulating that might block the virus's the vaccine's effect.
So I have to be quick with you, but if you are a parent of a child less than 12 months old and you live in an area where there is an outbreak, is there anything you can do?
Yes, there are recommendations, and it differs from jurisdiction to jurisdiction, to get the vaccine a little bit earlier to protect the child. There's also immune globulin that you can give to children who have been exposed. And that's going to be something that people need to talk to their pediatrician about if they're in a particularly vulnerable part of the country.
Okay, Dr. Amesh Adalja, thank you.
Thanks for having me.